Hello everyone. As you know, Shukan Multi-Speciality Hospital is always in the front line when it comes to patient education in terms of preventive medicine. Here once again on the day of World Cancer Day, I, Dr. Sanket Mahajan, am here to give some education about the cancer components, mainly to the preventive part and why it is so dangerous. Everybody knows the word cancer. Why so? Because when a patient is labeled to be having cancer, they feel that they are down totally, completely, morally and physically also. Why so? Because everyone knows that cancer is a silent killer. Silent killer in the sense it spreads rapidly, and by the time you get the symptoms, it is most of the times too late for the treatment component. Why so? Because the preventive medicines are not that easily available for cancer. It depends on the type and site of cancer. Regarding the curative part, a few years back it was like a cureless disease. There was no cure for cancer a couple of years back. But now when you see, there are lots of medicines available in the market routinely. And after consultation of an oncosurgeon or oncologist, the treatment part is divided into two types mainly. Either you prolong the progression of the disease by giving the medicines when you are presenting late to the doctor, or you can directly go for curative treatment which occurs in very less number of patients. So the need for a cancer organization society was there. So it was organized in 1933 and it is usually celebrated on 4th February in different types. People celebrate it in a different manner. Some go for slogans like yes we can, I can. Nowadays the trend is like no hair selfie is going on. Now when we talk about India, and when you compare the incidence of cancer in 2019 as compared to 2018, it has risen by almost 300%. There were 8 lakh deaths because of cancer in 2019 itself, and the highest number of cancer patients were found in Gujarat. Now, how do you know whether the patient is having cancer or not? When you have the following symptoms like unexplained weight loss, once you investigate the patient thoroughly and there is no reason found why the patient is losing the weight, or there is unexplained bleeding or unexplained pains in the body, then you should go for a further step ahead and screen for the cancer component. This was about the signs and symptoms. Now, how do you treat? Go for consultations, aggressive consultations, investigations. Do as recommended by the treating doctor, howsoever difficult it may be, because the treatment itself is very demoralizing, but in some cancer patients it is curative. So better to go for surgical, chemotherapy, radiotherapy, whatever the treating consultant suggests, and howsoever painful it may be, but you have to finish the treatment, which will definitely yield positive results. Regarding the prevention part, it is comparatively very easy these days. Eat healthy, have extra fibers in your diet, avoid smoking, alcohol, tobacco, or exposure to some toxic chemicals. Right, as it is rightly said that the time is shortening. The moment you start fighting cancer and survive, it is like winning all the battles when you know that you are fighting a losing battle. So this was all about cancer. The slogan for cancer nowadays is like, as it is rightly said, time is shortening. As in when you fight this cancer and survive, it is like a victory for me. So the take home message from me will be, an ounce of prevention is a quartz of cure. Thank you so much.